What does it look like when somebody goes through a course of Accutane for severe acne, and what effect does that have on them personally?
Today I want to tell a story about arguably the worst period of my life, a period where severe depression and social anxiety controlled me, and it was all because of a little thing called acne.
Today we're going to be reacting to an Accutane journey story from Joe Frazier, a well-known YouTuber who battled significant acne, and we're going to see the effect that that had on him while talking about the risks and benefits of Accutane and my perspective as a board-certified dermatologist. I treat acne every day and I prescribe Accutane almost every day to my patients, and I've taken it personally. My wife has also taken it, and a lot of my staff members have taken it. And if you're contemplating going on Accutane, it can be helpful to see somebody else's journey and also learn the pros and cons from a dermatologist, because not all of the information that you find online will actually be true.
Okay, so let me take you through the journey of how my skin went from looking pretty good to it going absolutely out of control, and what I did to sort that and regain my confidence again.
Quick little
And
look
the
at
best way
his
to tell the story
transition.
is to go from the very start.
Look at what he went
So,
through.
growing up, my skin was always on and off. In general, it wasn't great, but it was never that bad.
Pretty normal
where I didn't
teenage
think about it
acne.
much. I didn't really care. Now, about a year ago, my skin was looking pretty decent. Still the odd
Looks
spot here
great
and there,
there.
but it looked good. At this point in my life, I was the best looking I'd ever been, and my confidence levels were really high.
Yeah, I mean, he looks great there.
And this is where things went downhill. At the start of July 2022, I got so obsessive with how I looked. I was so addicted to trying to be more attractive. And I don't know if this was the reason or the blazing hot heat that summer, but my skin started to flare up a bit. The acne was getting a little worse, and I couldn't stand this. Even though the acne genuinely wasn't that bad.
Not too
because I
bad
was so
there,
obsessed
mild to
with how I
moderate.
looked, I would go to any lengths to fix this.
So we see that he had, normal teenage acne problems, and then his skin was actually looking pretty good until he really committed to his physique in the gym. And he doesn't talk about this in the video, but there is something to that, especially when guys hit the gym and you're lifting consistently heavy weights, you're going to experience an increase in your testosterone. And the other thing that he doesn't mention that I think may have played a role is we saw in one of the photos that he was posing with a supplement. It actually had his name on it as an influencer. He apparently has his own line of supplements. But there are certain supplements that are known to increase the risk of acne, particularly whey protein has an androgenic effect in the body, and that can increase acne. I've seen this dozens of times with high school football players who start going to the gym over the summer and they start taking protein supplements because their friends have recommended it, and they come in as school starts and their acne is out of control. And it's totally okay to want to improve the way that you look and hit the gym. I've been through it myself. In the last 5 years, I went and got braces, I shaved my head, I hit the gym, all because I wanted to improve the way that I look and gain more confidence. It wasn't because I didn't like myself, but I wanted to be a better version of myself. But it can sometimes come with some downsides that we see here. It exacerbated his acne, and when you're really focused on the way that you look, that's very distressing. So we're gonna see what he did to try to fix this.
Find the most powerful, the most extreme acne cure there is. And many options came up. Skincare routines,
I know those
acidic
guys.
products, medication. There was tons to choose from, but one product stood out from the rest. This was the product.
Accutane.
It's a drug called isotretinoin, or better known by the public as Accutane.
Last September, a new drug was released for use in the United States.
It's one of the most effective medications for acne, but there are some risks.
The drug is called Accutane.
This is one of the most controversial drugs to date. The side effects on this are endless. Dry lips, dry skin, joint pain, nosebleeds. But the more serious one, Accutane is linked to severe depression.
Let's talk about the side effects for a minute. The first one is dry lips, dry skin. This is almost a given during any course of Accutane. If my patient's lips are not starting to get dry, I probably don't have them on a high enough dose. And we're going to increase that until they start to get dry. As Accutane goes into the body and it's absorbed, it actually goes into the skin cells and into the oil glands. What we're going to see is a decrease in that layer of dead skin cells on the top of the skin. and we're going to see the oil glands start to reduce their activity. So when your skin is not producing as much oil and you're getting thinner skin on the very top layer, you may actually increase your collagen, but you're going to get dry skin. And your mucous membranes, because they are generally so wet, they're going to get really dry first. I find in my patients that about 10 to 15% of them develop joint pain, and it's never anything that has persisted beyond a course of Accutane, and I've never had a patient where it limited their daily activities. The football players, the wrestlers, volleyball players, track athletes, they were all still able to compete without diminished performance, but it's certainly a nuisance if it happens to you when you're waking up in the morning and you're just more stiff and sore than you're used to being. The nosebleeds can happen again because your mucous membranes in the nasal passages will also get dry. So I often recommend to my patients to sleep with a humidifier in the bedroom, to use a saline nasal spray, and to even put Aquaphor or Vaseline up the nasal passages to help keep things moist. Now, they talk about Accutane being linked to severe depression, and it is important to know that it is on the label for Accutane that it could cause an increase in the risk of depression. When we look at the actual data on Accutane and depression, there's been a number of high-quality studies done, and essentially what we can say is that the rates of depression in a group of patients that take Accutane are really no different from the rates of depression in a group of patients that did not take Accutane. We know, unfortunately, that many people have mental health struggles, and the teenage years are really hard anyway. So it is a time in life when you're focused on your appearance, when you're subject to, problems with friends, and especially if you have a family history of depression, you might be at risk for that. But the rate of depression is no different if you take Accutane or don't take Accutane. Now, this does not mean that if you take Accutane, it couldn't cause depression for you. Everybody can react to a medication in a different way, but we cannot confidently say that Accutane causes depression at any higher rate than the general population. And I think this is important to know, and it's a point that when I share it with my patients, they come in with their parents and they may be concerned about depression. That fact tends to give them a lot of comfort because, especially if they don't have a family history of depression, then we don't really have a lot of worry in putting somebody on Accutane. The other thing that I have noticed with my patients that take Accutane is actually many of them get happier. Because if you're concerned about your appearance and you don't like the way that you look, and we can get you through a course of Accutane, a lot of times the mood will actually improve. You'll have more confidence and you're not going to feel depressed. Many people are more depressed by their acne than they are when taking a course of Accutane. And I'm not trying to diminish anybody's story that may have lost a loved one while they were taking Accutane, but I'm simply telling you what the data shows us. And there's many, many studies. So a correlation is not a causation, and the rates in a general population are exactly the same. And some studies have actually shown that the people who take Accutane have a lower risk of depression than the general population. So in all of the data that we have, we cannot say Accutane causes depression.
Many people have taken their lives on this drug. Suicidal thoughts are common, and while this is a very
I wouldn't say they're
controversial
common.
topic, one thing is for certain, my acne was nowhere near extreme enough to even consider this. But as I said earlier, I was so obsessive with how I looked, I didn't listen to any of this and got myself prescribed on it.
I would not say that suicidal thoughts are common on Accutane. When I prescribe Accutane, I see my patients back every single month, and I screen every single one of them for depression. And in now almost 12 years of doing dermatology, prescribing Accutane, and interviewing those patients every single month that they're on it, I've only had one patient who had developed new onset depression or suicidal ideation while they were taking Accutane. And in that instance, we did stop the medication and they went and received treatment for depression, and they actually came back to us 2 months later, restarted Accutane and finished their course and really did amazing, had a great result. So that was an excellent outcome. I ask patients every single month, and I do not have any type of signal in my patients for an increase in depression or suicidal ideation, and I think that's important to know.
Okay, here we go. My Accutane journey starts today.
Now we're starting Accutane July 2022, taking it with some water.
Things were about to get much worse.
Here we go, week 1,
As the weeks went on, I noticed the classic
Dry lips bad.
dry skin, but there was one side effect which was really getting to me.
I've been on Accutane for 3 weeks. I think my skin has broken out a bit. That's normal, apparently.
This is called the purging stage. It's where your skin gets worse before it gets better, and this really affected me.
So let's talk about purging with Accutane. It is absolutely possible when you start Accutane that your acne will get worse for a period of time. But this does not happen to everybody, and I would say it's a minority of patients that this happens to. The most common type of patient that will experience a flare of acne are teenage boys with severe acne going into the course of Accutane. And if that's the case, we'll often put them on a course of steroids at the same time to help minimize the risk of a serious flare when they start Accutane. So it's certainly possible, but not that common to have a significant purge. Maybe a little bit worse for a higher percentage of people, but not a severe flare of acne.
As the weeks were going on, my skin was getting worse and worse. I had never in my life seen it this bad, and it really started affecting my mental health.
Today's the 5th of August, and today's been one of the worst days of my life.
So he's definitely developing depression, but I don't think the depression is being caused directly by the Accutane. Yes, the Accutane is making his acne worse, and that's making him depressed, but it's not a physiologic mechanism of the Accutane causing depression.
Thing is, I've never had mental health problems ever in my life. I've always been a happy, full of life guy. So this was a weird feeling for me. This video I took here,
Time to
capturing
end
the
this
time to
nightmare.
end this nightmare, was taken on the 18th of August. So it had been about 2 months since I first took that Accutane pill. At this point, my acne was out of control, my mental health was on the rocks. So I made the decision to quit Accutane. This made me feel a sense of relief. I felt happier again. Maybe my skin would go back to just being like kind of crap, and I could deal with that. I was excited for the future. I was excited to end this nightmare, as I said, and go back to being happy. But unfortunately, that didn't go to plan. In fact, the complete opposite happened. After I came off Accutane, my skin just got even worse. Cystic acne started forming on my neck, big spots on my face, and my mental
This
health
acne
was
looks
still
much
in the
worse than he
gutter.
had before
So
starting
I had a
Accutane.
decision to make. I could carry on waiting it out and just hope things got better over time. Or I could use the drug which started this nightmare in the first place. A drug which potentially was my only option to end the nightmare. I chose the latter. I just said to myself, it can't get any worse than this, so fuck it. So on the 7th of October 2022, I restarted my Accutane.
The acne got worse and he decided to go back on Accutane. And this tells me that he wasn't depressed from the Accutane. He wasn't worried about that. But he was now coming in with a proper understanding of the expectation of what was going to happen when he went on Accutane. And this is something that it takes a good relationship between a dermatologist and a patient to understand that sometimes the acne may flare, it may get worse, and how we can help to walk patients through that using things like alternate day steroid dosing or other potential interventions. Now, the laws in America require us to see our patients every single month when we are putting them on Accutane. And I don't know if that's the rules in his country, if he had to see the dermatologist every month, because there are some places where you can just get the prescription and have it refilled. And if you're not counseling with a dermatologist every single month, then he may not have had the opportunity to discuss these side effects with a dermatologist. But if you're taking any medication prescribed by a physician and the treatment course is not going well or not going to meet your expectations, you should definitely go and talk to that physician and try to understand if there are other interventions that might be more appropriate for you or something to help mitigate the side effects. So I really don't know from his example if that was available to him, but he did decide to go back on the Accutane, and we're going to see what happens next.
It's 7th of October 2022. I hope that I can watch this video next year and I won't have fucking horrible skin, which fucking destroys all self-confidence.
The starting point wasn't great, but I was ready. I was ready for the next 6-7 months to be
You can
tough.
tell he was just
I
more
was not
mentally
gonna enjoy
prepared
it,
this
but I knew
time.
if I committed, then I'd hopefully get my confidence back.
1 week on Accutane,
Every week I would take progress videos of my acne.
2 weeks on Accutane, 3 weeks,
4 weeks,
5 weeks, 6 weeks.
This
7
can be
weeks,
really
9
helpful,
weeks.
and I hope it's
Finally,
valuable
as
for
time was
you
going
to
on,
see
my
this
acne was
transition
actually
week after
relieving.
week.
And I want to update you. I feel fucking awesome. I'll be honest. My
Look at that
skin isn't
smile.
fully cleared, but the fact that it's getting better, it's just.
I mean, he's getting
the best
emotional.
feeling in the world.
We distinctly see an improvement in his mental health rate here. As the acne starts to clear up, his mood is so much better. And I love seeing that as a doctor when my patients start to see that progress and they come in. And I can't tell you the number of times when a patient has come into me with seriously bad acne and they maybe have a hat on or a hoodie, they're looking down and they don't want to look in your eyes because they're so ashamed at the way that they look. And then sometimes 3 or 4 months later, they come in, they're wearing a t-shirt and they're literally bouncing down the hallway into the exam room because they are so happy with the way that they look. And I absolutely love that we have a medication to offer that can help individuals to regain that confidence and to improve the way that they look. As I mentioned, risks and benefits to Accutane. And this really requires a conversation with a board-certified dermatologist to determine the appropriateness of the therapy for you. But my experience in dealing with thousands of patients that I've treated for acne, and many of those with Accutane, is that it can really restore somebody's confidence. And I love to see the smile that we saw on him. I've seen it so many times in my own patients, and it really is a magical moment when somebody knows who they are and they have that confidence again.
My general mood, my life, my outlook on the days were improving. I started feeling happier again, and it was simply because I felt more confident again.
You can see that smile.
20 weeks on Accutane. 21 weeks. 22 weeks. 24. 25 weeks.
26 weeks. My skin was genuinely becoming clear again. It was the best it had ever looked. And after 33 weeks on this drug, my skin completely transformed.
33 weeks, completely clear skin at that point.
And I'm happy to say I'm now acne free.
Today's the 5th of August, and today's been one of the worst days of my life.
Watch this transition. Incredible result.
I'm a lot happier now, I'll be completely honest. I still have a bit of the odd scarring, but I am so much more confident. I'm enjoying life again. It was a very tough journey, but I'm glad I went through it. And the question which I'm sure a lot of you are wondering is, do I recommend Accutane? You know, it took me through some of the worst and the best times of my life. So I have very mixed opinions on it. I personally am very happy that I did it in the end, but I'm really not qualified enough to give my opinion on such
I really
a
appreciate
controversial
that he
drug.
acknowledges that he can't tell you whether you should
and
take
if they give you the
Accutane.
green light, then I'd say do it, but with caution.
So I want to thank Joe for sharing his Accutane journey, and I thought he was very fair and balanced on that, and I really appreciated that he was vulnerable during that time and shared the struggle that he went through. And it was not an easy thing for him to do, to go through that course of Accutane. But when he was mentally prepared for the side effects, he was ready to do it. And he had a really great outcome. And I've seen this hundreds and hundreds, probably thousands of times in my clinic. So the question becomes then, should you take Accutane? And here's where I think it's appropriate to take Accutane. Certainly if you have severe cystic scarring acne, then you're going to be a good candidate for Accutane, just from a skin perspective, not speaking about some of the other things. But that is the most appropriate candidate for a treatment course with isotretinoin or Accutane. If you have moderate acne that is not able to be controlled with topical medications or other oral options, that's also, in my opinion, an appropriate time to treat with Accutane. And in some circumstances, I have taken patients through a course of Accutane with very mild acne that just never goes away. So again, it's mild but very persistent acne. For those patients, we often work through many more treatment options to try to find what's going to work for them. And one of the downsides of at least the American healthcare system is that I do believe that there's other treatments, especially for those mild patients, that could work really well, like laser treatments or certain chemical peels, but those are never going to be covered by insurance the way that things are right now. And so if they don't have the money to spend out of pocket, but their insurance company will cover Accutane, it's kind of a big drug to treat very mild acne, but sometimes it is the option that they need. And so that's where I have a very good conversation and a really great relationship with my patients to know what's going to be best for them. And we discuss all of the risks and the benefits. It's not to acknowledge that this is a drug to be thrown around trivially for every single patient that walks in the door that has a pimple, but it is something that in the right patient, I think it's a very good drug, and it takes a good relationship with your dermatologist to determine if you are a good candidate, both from the type of acne that you have and the other risks that you might be at risk for. Other things that would push me away from treating somebody with Accutane is uncontrolled mental health issues, especially bipolar depression. Somebody who drinks a lot of alcohol is not a good candidate for Accutane. If you have a genetic mutation that causes your triglycerides to be through the roof, you probably can't take Accutane because Accutane can raise your triglycerides. It raises your liver enzymes a little bit, so if you drink a lot of alcohol and you have elevated liver enzymes, that may make you not a good candidate also. Now, no doubt a video about Accutane is bound to draw some critiques in the comments, and I'm happy for anybody that wants to ask questions and just ask that you please be respectful. I understand the risks and benefits of Accutane. I've taken it myself, as I mentioned. It is not a toxic drug that should be banned from the market, and it is also not a drug that is appropriate for everybody that has a pimple. So if you have questions about Accutane, concerns, or you want to share an experience down in the comments, I would absolutely welcome that. And if you think somebody would benefit from this video, it'd make my day if you'd share it. The reason why is that my passion is to go provide free dermatology care for as many people as possible. In fact, I even bought a motorhome to help make this a reality so I can travel to rural communities and underserved communities to do that care. And when you watch videos and you click the links in the video description, it really helps my channel. And so I greatly appreciate it because I'd love to just work for free for the rest of my career if that were ever possible. So thank you guys for watching, and I'll see you guys on the next video.